Eagles Hospital, Medini, Johor, we know that you are not just another patient. You are a mother, a father, a teacher, our unsung heroes, our future. That is why we pay attention to everything we do. From our unrivaled service, and cutting-edge equipment and facilities. To our renowned doctors, nurses, we cater our services to fit your time, your needs. Because here at Eagles Hospital, Medini, Johor, you are special and important to us. Welcome to Eagles Hospital, Medini, Johor. A hospital that is truly on your side.
Good afternoon and welcome to Facebook Live Lunch Date with Gleneagles Hospital Medini, Johor. Today we are honoured to have Dr. Teo Yin Keong, our resident clinical oncologist, to discuss about breast cancer. If you have any questions to Dr. Teo, please send in your question to the comment box below and Dr. Teo will try to answer your question towards the end of the session. Today we are talking about breast cancer. Breast cancer is the most common form of cancer affecting women in Malaysia. About 1 in 19 women in our country are at risk. Did you know that breast cancer afflicts an estimated figure of more than 1 million women in the world each year and is the second leading cause of cancer death among women worldwide, second to lung cancer? So there is a common saying, early detection saves lives. So Dr. Teo, do you agree that early detection of breast cancer, the chances of survival are very high?
Yes, this is definitely true. According to what you mentioned just now, 1 in 19 ladies in Malaysia will be at risk at having a breast cancer. But from the data that I have now, internationally, 1 in 7 ladies will be diagnosed as breast cancer throughout their lifetime. And this number is extremely high.
Yes.
And for early breast cancer detection, we have only two main, very effective and very cheap method: ultrasound breast and mammogram. These two are undeniably the two most important techniques to detect early breast cancer. Why we need to detect it early? Because if the breast cancer is detected at the early phase, let's say like stage 1 or stage 2, their survival is and curative rate is as high as 90%. Once the cancer stage reached stage 3, the 5-year survival reached 50% only. And the curative rate also reached about 40 to 50%. And if the cancer is diagnosed or reached stage 4, there's no longer able to be cured. And the 5-year survival rate is just about 20 to 30%.
Okay. Okay. So, doctor, for women, once we diagnose with breast cancer, so most of the women we will try to avoid operation because we want to maintain the physical completeness as a woman. So, doctor, is it possible to treat breast cancer without removing the lump?
Unfortunately, for breast cancer treatment, stage 1 to stage 3, if you are going for cure, surgery is not avoidable.
Okay, it's a compulsory.
Yes, it's a compulsory. And for selected stage 4, we may still proceed with breast surgery to reduce the symptom or to minimize the any issue that can come after the breast mass. Yeah, so selected stage 4 can still go for breast cancer surgery. Whereas for stage 1 to stage 3, they inevitably have to go for surgery somehow.
Okay.
Yeah.
Okay. So if a patient decided to go for a breast cancer surgery, then after the surgery, what will be the next step?
Okay, after the surgery, the sample of the tumor will be sent to the lab for further analyzation, and then they will look at the tumor behavior, look at the receptor, hormonal receptor status, and then they will check on many other characteristics of this particular cancer. And based on this particular characteristic, and together with the cancer staging scans, such as CT scan or X-rays or ultrasound or PET scans, we will finalize the cancer stage. At this moment, from this moment onwards, then we will formulate what kind of treatment is suitable for this patient, such as going for adjuvant chemotherapy or adjuvant radiotherapy, hormonal therapy, targeted therapy. All these are based on the report and the staging imaging after we have done all this surgery.
Okay. Okay. So, and Dr. Teo, is breast cancer curable in stage 3?
Yes. As like what I mentioned earlier, stage 3 is still considered as a curable, but then the curable curative rate is just about 50%. So we try to enhance the curative rate by detecting at the earlier phase. Yep. At stage 1 per se, just I already mentioned, almost 90% or more than 90% are curable. But when it comes to stage 2, it's about 80% only. Stage 3, 50%. Stage 4, no longer curable.
Okay, understand. So, Dr. Teo, so we heard about triple negative cases. So, can Dr. Teo explain what is this exactly? What is this triple negative breast cancer?
Okay, triple negative breast cancer refers to one of the subvariant of the breast cancer, in which the triple negative, the three things that is negative is ER receptor negative, the PR receptor are negative, and the HER2 receptors are negative. Why we so focus on triple negative is because triple negative patients, they usually have poorer outcome and shorter lifespan. Why we say so? Because once these three receptors are negative, that means the effectiveness and the availability of some of the adjuvant treatments cannot be applied to this patient. Therefore, their responsiveness to the treatment will be lower, and therefore they can only go for chemotherapy.
Okay.
Yeah, and the chemotherapy is by definition is by default is very toxic and then very not easy to go through, and yeah, some patients may not be able to make it.
Okay, so doctor, for this group of patients, triple negative breast cancer patient, what are the treatment options available for them?
Their treatment available option usually left with the chemotherapy. Yep, only chemotherapy. They have no other options, because once the ER, PR receptors are negative, they won't be able to get any benefit from the hormonal therapy. And once the HER2 receptors is negative, they won't be able to get any benefit from targeted therapy. And as we all know that hormonal and targeted therapy they are one of the most important component in preventing the cancer to come back.
Okay.
Yeah, since they don't have this two treatment, therefore, yeah, their recurrent risk is higher.
Dr. Teo, in general, what can we do if the treatment doesn't work, or if the cancer come back again?
Okay, during the cancer treatment, during the phase of treatment, when we notice that the effectiveness of the treatment is not up to expectation, or the patient progress despite having a treatment, then we usually will stop the current treatment and discuss with the patient with the whatever available remaining options that is still possible to be run. And the options is a lot, and this is case by case basis, depending on patients' tumors characteristics, and then depending on how many areas involved and remaining available options involved. So this is very subjective and may be different from one person to one person. Yeah.
Okay. So the next question will be how to treat the breast cancer during pregnancy And is cancer medication safe for unborn baby?
Unfortunately, some of the pregnant lady will be detected to have a breast cancer during their pregnancy period. And most of the cancer management, they are considered toxic to the pregnancy phase. And for chemotherapy per se, usually if it's not avoidable to have the chemotherapy during the pregnancy phase, we will run the chemotherapy during the second and third trimester. Okay. Whereas for hormonal therapy and targeted therapy, they are not safe during pregnancy. Okay, and then for radiotherapy, they are not considered as safe during the during the pregnancy phase also. Therefore, we left only with surgery or chemotherapy. And usually the surgery will be brought forward. We won't wait for normal delivery. Usually they will discuss with the gynecologist and together with the pediatrician to see whether can we bring the baby to nearly term, which is about 35, 36 or 37, 38 weeks. And then we'll do a cesarean section to bring out the baby, and then so that the mother can continue the treatment.
So that the mother can be safe.
Yeah. In some situation, if let's say is the cancer is detected at early phase, let's say during first trimester, and the cancer progress very fast, and we will compromise the overall qualities of the management, and then the patient may have risk of mortality during the pregnancy phase. We will discuss with the patient to consider early pregnancy termination. Okay. So that the mother can safely go for the cancer treatment.
Okay, thanks for the answer, doctor. Okay, so and then my next question will be, how will the chemotherapy or radiotherapy treatment affect patient daily activities, and can the patient still work as full-time? What do you suggest, doctor?
Usually, I wouldn't suggest patients to run their full-time daily work after when they have chemo or radiotherapy. I would advise the patient to have more rest. But unfortunately, we have a lot of working ladies nowadays, and if they have no choice, I will discuss with the patient, and so that they can bring the message to their company or to the employer that during chemotherapy, first week during the chemotherapy of every cycle, first week, usually they are not advisable to go to work. They will be quite weak. They may have nausea, vomiting, and they will have very poor appetite, and they will look very weak, malaise and fatigue. So they are not advisable to go to work. Second or third week onwards, if their body fitness level regain back to normal level, they may be considered to go back to their workplace and perform some light duty or some paperwork. Whereas for radiotherapy, most of the time, it's still considered to be quite safe and okay for most of the patients. Therefore, almost all my patients can continue their daily routine during the radiotherapy phase. Okay. So the radiotherapy part and the chemotherapy part is a bit different. Yep. Chemotherapy part more fatigue. Radiotherapy part they're quite okay. Yep.
Okay. So for breast cancer survivor, how can we know that if the cancer has come back, or what are the things that we should watch for in order to prevent the cancer to come back again?
Okay, for all the cancer survivors, they should be fully aware of what are the early signs and features of the cancer to come back, such as if they have unexplained mass or pain elsewhere, or their previous operated areas start to have unusual nodules or skin changes, or they start to have armpit or the neck swelling, or they have unexplained loss of weight and loss of appetite, or become more weak or more fatigue lately. These are all the high risk symptoms. And I also would advise the patient to continue long-term follow-up. Unfortunately, a lot of patients, after their treatment completed for more than 3 years or 2 years, they will before the follow-up, they don't come back. They may think that, okay, I have done all the things already, my cancer is cured, so I don't need to see doctor anymore. And this is one of the biggest mistakes they have done. So I will still advise patients for the first 5 years, try to stick to your doctor first, and then from 5 years onwards, try to continue the long-term surveillance follow-up, such as at least once or twice per year. With the if it's needed, you may need to repeat your mammogram or ultrasound when necessary.
Okay, once a year or twice a year?
And that depends on a case-to-case basis, and depending on is there any suspicious thing that you need to monitor.
Okay.
Yep.
Okay. Thanks for the answer, doctor. Yeah. So we are towards the end of our session here. So as with most cancer, the earlier breast cancer is detected and diagnosed, the better the chances of successful treatment. Okay. Screening tests can help to prevent breast cancer or find it early when treatment works the best. At Gleneagles Hospital Medini Johor, we do have package for breast screening. Kindly contact us for more information. Thanks to Dr. Teo and to our viewer, thanks for tuning in. Stay safe and stay well.